Diagnosis by 6 meridians. Diagnosis by the 6 meridians is the method used in the treatise on cold attack to differentiate illnesses due to attack by exogenous cold. The 6 meridians is a general term that encompasses the 3 yang meridians, Tai Yin, Yang Ming, and Shao Yin, and the 3 yin meridians, Tai Yin, Shao Yin, and Jue Yin. It is an extension of a method in the plain questions which Zhang Zhongqing Eastern Han Dynasty devised specifically for exogenous cold illnesses. Since then, it has proven its usefulness. This method uses the 3 yin meridians and the 3 yang meridians as the framework on the basis of the propensity of illnesses of cold attack to transmit from the exterior to the interior, from the shallow to the deep. The Zangfu organ and its meridians belonging to each of these 6 meridians have their own yin-yang affiliation and partake of yin-yang, each to its own degree. Consequently, when under attack by the same exogenous cold, each organ and its meridians manifest a different set of pathological changes and a different development. This was the impetus that led Zhang Zhongqing to develop this method. The method of diagnosis by the 6 meridians assigns all illnesses of cold attack to the 3 yang and the 3 yin meridians. It establishes the standard progression of such an illness from yang to yin, from exterior to interior, Tai Yang, Yang Ming, Shao Yang, Tai Yin, Shao Yin, Jue Yin. It further clarifies the understanding that in the course of an illness, each stage has its own characteristics. The method also emphasizes the mutually influential relationship among these 3 yang and 3 yin meridians. For these reasons, proper application of the method of diagnosis by the 6 meridians can help the physician to accurately identify the cause of an illness of cold attack, its development and progression of transmission, and to guide the physician in its treatment and his choice of herbs. Let's start with the Tai Yang meridian. The Tai Yang meridian encompasses the superficies of the body and serves as the protective fence for the other meridians. When exogenous wind or cold attacks the body, mostly it first attacks the Tai Yang meridian. Genuine qi rises to do battle with evil qi. The struggle between genuine qi and evil qi in the exterior gives rise to the symptoms of Tai Yang illnesses. Tai Yang illnesses are of 2 categories: Tai Yang meridian, Tai Yang fu organ. Illnesses of the Tai Yang meridian are those in which exogenous evils attack the superficies. Because of differences in patient's constitution and in the nature and virulence of the pathogenic evils, there is the further differentiation between wind invasion and cold attack in Tai Yang. In an illness of wind invasion in Tai Yang, the symptoms are those of the wind evil attacking the superficies. So the defensive qi and nutritive qi become disharmonious. The main symptoms include headache, stiff neck, fever with sweating, wind intolerance, and a floating and even pulse. In an illness of cold attack in Tai Yang, exogenous cold attacks and binds the exterior and blocks out defensive yang. The main symptoms include headache, stiff neck, fever with chills, no sweating but dyspnea, body aches, and a floating and tight pulse. The Tai Yang Fu organ. In an illness of Tai Yang Fu organ, the exogenous pathogenic evil is not expelled but progresses along the meridian to the urinary bladder. Clinically, there are 2 patterns: water retention and blood stasis in Tai Yang. In water retention in Tai Yang, heat evil in Tai Yang is transmitted into the urinary bladder where it blocks bladder qi and causes it to stagnate. The symptoms are fever, wind intolerance, sweating, much thirst but vomiting upon drinking, difficult urination, lower abdominal distension, and a floating pulse. Blood stasis in Tai Yang results from a combination of exogenous heat, gelling, and blood becoming static in the lower abdomen. The symptoms are spasms or hard distension of the lower abdomen, insane or wild behavior, normal urination, and a pulse that is deep but impeded, or deep but hesitant. In some patients, there may be jaundice. Thank you for your attention.